The challenges at times are overwhelming, but there is reason to be optimistic because there are clearly areas where investment of modest sums and a lot of hard work have had enormously positive outcomes. In southern Zambia, for example, where the regional hospital has partnered with Johns Hopkins for a Malaria Research Institute, the good work of Philip Tuma, a medical doctor from the United States who grew up in Zambia and has worked there now for 35 years, has gained trust in the countryside. And so our investigation to identify who's carrying malaria has had a very productive outcome. In fact, it's led to a 97% reduction in the prevalence of malaria in the area. And so if scientists and doctors in a small area can do that, it can be done elsewhere. The entree of philanthropy into these areas, global health in particular, has been enormously beneficial. It's not like these diseases just melted away. They're huge problems. But there's only so much the U.S. taxpayers are able to support, willing to support, and the needs are greater than that. And so, frankly, the philanthropy at Johns Hopkins, and Mayor Bloomberg was our biggest donor, have made programs emerge and flourish. We're fortunate to have generous funding from the National Institutes of Health, particularly for our programs in Zimbabwe and Zambia. The ICEMR is the acronym, International Centers of Excellence for Malaria Research. U.S. taxpayer funded. It's allowing us to track the epidemic currently. And 9 other centers around the world, we're going to get a good handle on the parasite evolution, the appearance of drug resistance, insecticide resistance in mosquitoes, and that's taxpayer funded as well. We did not expect to meet with Mr. Ahmadinejad, but he requested it. We spent a week in Iran, and I know there's a lot of concern by members of the United States that think that we should have nothing to do with Iran. They're the devil. And I understand their viewpoint. But I think having some contact is better than having no contact. And having visited Iran and talked to hundreds of Iranian scientists, students, my take is, by and large, they love the United States. They're afraid to say anything about their own regime, and that's off limits. But if we limit ourselves to talking about science, they want to come to the United States. They want to do science. And they know that many Iranian expatriates have come to the United States and had enormously productive careers. They've not been able to return to their home country. Many would like to. So I think it's a matter of kind of maintaining contact. And of course, no one here wants them to develop a nuclear weapon. But we could say the same thing about all the other countries in the Middle East. Wouldn't it be nice if we someday had a nuclear-free Middle East? First off, even the non-scientists in these countries view U.S. science and technology with great admiration. Polls have shown that even in countries that have dim views of U.S. in general, like our science and technology, our electronics, our medical devices, our medical discoveries. So it's an opportunity. And of course, the scientists we meet in these countries are largely individuals like ourselves. Their major motivation is to make the world a better place for their children and their grandchildren. And the ideology is not a part of the visit. And moreover, I think it's important that we maintain kind of a pure scientific approach, or we'll be thrown out of the countries very quickly. At the same time, we don't want to validate cruel regimes. We're not there to pat them on the back and say, you're doing a great job. We're there to help advise them to do the best science they can.